Some places in the states dealing with their worst COVID rates in the past week. Situations especially bad in Georgia as the state surpassed 20,000 dead connected to COVID-19. Good evening to you. Georgia went over the total on Friday with 106 that have passed away. Georgia has also confirmed more than 1 million cases of COVID-19 since the pandemic began. News4JAX reporter Marilyn Parker joining us live. Maryland, Georgia hospitals are overwhelmed with COVID patients.
They are. We're told 95% of ICU beds are now occupied. The state has increased their efforts trying to help out these hospitals as much as they can this week as this virus continues to spread. Georgia hospitals flooded with COVID-19 patients. They have the second highest number of hospitalizations in the country. The virus now taking the lives of more than 20,000 people across the state. Currently, 74,245 patients are hospitalized. That's Georgia's highest since the pandemic began. 95% of ICU beds are occupied. The surge started in Georgia last month. Earlier this week, Governor Brian Kemp deployed 180 National Guard soldiers to assist the needs in hospitals. They'll help in emergency rooms, critical care units, and assisting the nurses. The state doesn't release COVID data on the weekends. Friday, they reported 9,119 new cases and 468 hospitalizations. In the last 14 days, Glenn County reports 2,172 cases. Camden County had 572 cases, and Ware County had 348. Governor Kemp reminding the public the best fight against this virus is the vaccine. The vaccination rate in Glenn County is 42% and 32% in Camden County. Currently, 44% of Georgians are fully vaccinated. Some officials in Georgia say they are concerned with the possibility of another surge following Labor Day weekend coming up tonight at 11. A reminder and a warning from the CDC. Reporting live tonight, Marilyn Parker, Channel 4, the local station.
And welcome to another edition of the National Newspaper Publishers Association's Let It Be Known. Jeffrey Boney is one of the most prolific columnists in the country, probably the world. The award-winning associate editor of the Houston Forward-Times is also a Missouri city councilman who has battled COVID-19. He's also, like many Texans and certainly lawmakers, battling those Republicans who continue to pound on these voter oppression laws, these anti-women laws, and other undemocratic laws. We're going to talk to Jeffrey Boney about that this morning. Let's first the headlines, though. President Biden on Thursday pledged to use the full force of his presidency in a push to require tens of millions more American workers to get vaccinated against the coronavirus, including the vast majority of federal employees who could face disciplinary measures if they refuse. Through a pair of executive orders and other federal rules, the president said his administration will either require 2/3 of the American workforce to get vaccinated, and his administration will compel vaccination for federal contractors as well as 17 million healthcare workers in hospitals and other institutions that receive Medicare and Medicaid funding. Beyond that, the president said he wants to extend vaccine mandates to the private sector. He has instructed the Department of Labor to draft a rule mandating that all businesses with 100 or more workers require their employees to either get vaccinated or face mandatory weekly testing. The mandate for federal workers is an especially assertive move by the president because it could include termination for those who refuse vaccination. Also in the news, U.S. Senate Majority Leader Chuck Schumer and New York Attorney General Letitia James unveiled a comprehensive two-part plan to address the national maternity mortality crisis and eliminate racial and ethnic disparities in maternal health outcomes nationwide. We know that Black women especially are vulnerable to maternal health crises. Attorney General James has been a frontline champion in the effort to improve maternal health care in general and has focused on the urgent need to address the disparities in health care that impact Black women. Specifically, Senator Schumer said that in the upcoming recovery packages, he will first fight to secure major investments found in Black maternal health, something called the Momnibus Act of 2021. Second, he said he will push to make permanent a state option to improve Medicaid coverage to support pregnant women and new mothers, including instituting year-long postpartum Medicaid coverage and expanded Medicaid benefits to include doulas and midwives. My daughter is a doula, so I really appreciate that, Senator Schumer. And in the news also, Maleka, a life-changing nonprofit organization in the Democratic Republic of the Congo, has won a World Literacy Award for its significant contributions to literacy by an organization. The announcement was made at the World Literacy Award online event hosted by the World Literacy Foundation. The awards were judged by a 16-strong panel, which included writers, directors, and everybody from all walks of life, really, as well as the World Literacy Council. Through the incredible work of its founder, judges deemed that Maleka, a nonprofit organization that empowers girls in their communities in the Democratic Republic of Congo through education and health, as having demonstrated exceptional and sustained depth and commitment to the advancement of literacy. So congratulations. They do such great work there in the Congo. We certainly tip our hats to Maleka. Jeffrey Boney has endured COVID, but even after enduring COVID, there were some long-term effects that he has had to deal with. But also, as a Missouri City Councilman and as the associate editor of the Houston Forward Times, he has had to deal with so much Republican suppression in the state of Texas. He's here to talk about it now. Let us welcome the great columnist, Jeffrey Boney. Good morning, Jeffrey Boney.
Good morning. How you doing this morning, Stacey?
Oh, man, it's always a pleasure to have the preeminent columnist of the NNPA with us. How you doing?
Man. I don't know about all that, but I'll take it, man. Thank you so much.
Jeff, so you saw we'll start with COVID and then we'll work our way through the other things that you guys in Texas are dealing with. Especially, I mean, you could put on both hats, your journalist hat and your hat as a council member to talk about these things. But first, your personal battle with COVID. Jeff, when you see what's going on today, it seems to have gotten worse. We have these new variants. What's your take on the situation? What are you seeing from your perspective, someone who was really ill with this disease?
Yeah, so as many of you know, I was one of the first individuals who actually was a victim of this tragic and unprecedented virus, COVID-19, the pandemic when it first came out. I spent 9 full days in the intensive care unit, not even knowing that I had COVID. I had none of the primary symptoms that were talked about. And so, it spread fast. It was something that impacted so many people's lives. And because it became heavily politicized from the federal level, particularly at the time under the former president, it was something that, of course, impacted our nation in ways that we hadn't seen since the Spanish flu in the early 1900s. So, to see not only COVID-19 from its infant stages grow the way it did and impacting so many lives, not only with cases, but with deaths, and to see us to try to put our arms around it through vaccines and other methods, and then to see, certain administrations, not only at the federal level, but at the state levels, attempt to, put profits over people and politics over people. It was definitely disheartening to see. And as you see, things turned around and went back to the way that it was moving in, as far as, especially with this new Delta variant. So, fortunately for me, I'm a survivor of the virus, but I'm still, like you say, impacted. I just went back and got another CT scan on, I do that regularly. I'm not still suffering with the the virus, COVID-19, but I still have the after effects. So, I got diagnosed with another pulmonary embolism in my upper left lung, a smaller blood clot, but a clot nonetheless, after having spent a whole year fighting against a larger blood clot in my right lung as a result of COVID-19. And so, I was definitely impacted severely. So, to see individuals, take this, very, very loosely, especially again from the federal and state and local levels, is disheartening. And I encourage everybody to do what they need to do to, get safe, get vaccinated, whatever they need to do to protect themselves and others against this tremendous virus that we've never seen before in our lifetime.
Yeah, absolutely. And Jeff, before we continue the conversation, let us bring on the president and CEO of the National Newspaper Publishers Association, Dr. Benjamin F. Chavis Jr. Good morning, Dr. Chavis.
Good morning, Stacey Brown, and good morning, Jeff Boney. We're so pleased to see you, good brother, and you're one of our award-winning journalists, award-winning freedom fighters, elected official. You do it all, and and your voice, man, your testimony is so important. Hopefully that people will listen to what you have just said and what you will continue to say, what you write and what you continue to write. The Black press is vital at this moment in the history of our people. So many falsehoods out there, miscommunications, misinformation. And some of it, Jeff, I think is deliberate. I think there's some people in high places in the state level, in other levels, like you mentioned, the former president. I mean, he went and secretly got his vaccination, but encouraged other people not to. So it's the hypocrisy. It's a part of the systemic racism. I don't want to start preaching this morning. I'm just so glad to see you. And on behalf of the Black press, Karen Carter Richards, our distinguished chair there at the Forward Times in Houston, and y'all work together, man. I just wanted to say that all of us, man, we love you, we respect you. And we're glad that you were able to put up that fight. And you had some of the best doctors there in Houston working with you. And, I just think that Black America, we're not through with this, through this thing yet. A lot of people are taking it lightly. They're taking their mask off. They'll stop washing their hands. They'll stop social distancing. I think people should not play with their life. This is a life and death situation. The pandemic is the most serious situation that we've faced in over 100 years. I'm talking about in Black America. And we got to really take this thing seriously. And that's why, Jeff, you and Stacey and others in the Black press are so vital, not only to keep our people woke, but keep our people active, but keep our people engaged, keep our people standing up for what's right, not only for ourselves, but for all of humanity throughout the world.
Absolutely.
Yeah. And Jeff, so also, as Dr. Chavis pointed out, and you've pointed out too, we certainly are at a disadvantage as a people, right? But you had some assistance when you first got sick. You had some major assistance that not all of us are privy to, right? Sheila Jackson Lee, the Congresswoman out of Texas, stepped in and stepped up and really helped you. Talk about that a little bit.
Yeah, so Congresswoman Lee, Jackson Lee is a friend, but she's also a representative here who I've worked with collaboratively on a lot of community efforts for years, even prior to becoming a member of politics and member city council. But I will say that, when she found out that I had been ill, and I had been ill for going on a week, but I didn't think I had COVID. I just knew that I thought I may have had the flu or maybe from food poisoning or something like that, because I only had two symptoms. I had a loss of appetite, and I had the diarrhea. I had diarrhea. That was it. I didn't have shortness of breath. I didn't have a high fever. I didn't have a heavy cough or any of the things that were talked about at the time. And again, keep in mind, this was the early stages. I mean, there was only one case of COVID-19 that had been reported in Texas, in the greater Houston area at the time that I actually contracted COVID-19 and got ill. But anyway, she found out that I was ill because I did not attend a function. She called me on my cell and asked me, what was going on. She's like, Boney, I heard you weren't feeling well. And I said, yeah, she said, well, have you gotten tested? At the time, there wasn't this mass testing available. she had just set up various drive-through testing sites, at least a few, through the United Memorial Medical Center, and Dr. Joseph Barone, who was the chief medical officer there. And she was like, well, hey, I got this new testing site, why don't you come by and get tested and see, what the status is. And so I was like, sure. It was like truly an act of Congress to try to get me there, because I was my body was aching so bad. But I got up, made my way there that afternoon, got tested that Wednesday, went back home. The test took, literally 10 minutes. The doctor had given me his cell number and said, call me if anything changes. That next day, Thursday, I, wasn't feeling any different. I was, feeling the same, pretty bad. I couldn't move. I had already self-quarantined myself, but then that Friday morning, I woke up and started coughing up blood. And it was at that point where I called the doctor and was like, hey man, I don't know what's going on, but I need to see somebody. And he told me to come down to the ER, the emergency room at UMMC. I did. And something just told me, grab an overnight bag and grab my wall charger for my iPhone. I did those two things and made my way to the hospital for ER. I'm thinking that they're going to test me, and figure out what's going on, give me some medicine, send me back home. They said, we got to put you in the intensive care unit immediately because, you're in bad shape. I didn't know just how bad I was and that I was approaching death. My blood pressure was spiking. Also, my heart function had dropped below 30%, had double pneumonia in both my lungs. My liver and kidneys were impacted. And as I stated, they eventually found that I had a major blood clot, pulmonary embolism in my right lung. So I was in really bad shape, didn't know that I was approaching death, but I did have some great doctors, Dr. Joseph Barone and Dr. Joseph Gath, who were two of the top infectious disease doctors in the country. And they were there to help see me through. And I was discharged 9 days later on April the 5th.
Yeah, and Jeff, before we segue to another topic, we had recently Dr. James Hildreth from Meharry Medical College on. He's also a member of the White House's COVID-19 task force, and he's also was on the board to approve the vaccines. Dr. Hildreth said something very interesting, I thought anyway. We see schools reopening, and he kind of put a pause there on the fact that schools are reopening without these kids being vaccinated. He was not a champion of that idea of reopening schools at this point because, as he mentioned, folks are not following any type of mask mandates. There is no, the kids are not vaccinated. Jeff, what's going on in Texas as far as the schools reopening? What's that been like, and what are you seeing, Jeff?
Well, man, of course, as we know, there are children under the age of 12 that can't get vaccinated here. There's been an increase in spiked cases. Many school districts have had to shut down mere days after opening. Of course, again, putting profits and politics over people. Many of the superintendents and many of the key administrators and experts, argued, lobbied the state to deal with this and not do a mass reopening of a public school system. But our Texas Governor Greg Abbott ignored those pleas, as well as many of the state legislators here, particularly Republicans, of course. And they reopened those schools and have seen a tremendous spike in cases. Matter of fact, I just saw a report that 2 teachers recently passed away. From COVID-19 as a result of, having gone back to school and being subjected to this virus. And so, again, when you put politics over people and don't use common sense legislation and decision making through your executive power as the key leader in our state or any of the states that are across the United States that have done this, like Florida and others, you see these types of results and you can't backtrack it once you open up Pandora's box. And so that's what we're finding, that so many people are being now impacted because of these selfish decisions made by some of these leaders across the United States.
Yeah, and Jeff, you're a council person. You're a council member, Missouri City councilman, one of the bigger jurisdictions there near Houston. when you talk to people across the aisle, and I'm sure you talk to folks and in both parties, what's the sense you get? Is it one of these things where folks just want to go along party lines, or do you find anyone reasonable from the other side of the aisle?
There are some, Stacy, that privately are sensible in their thought processes, and you're able to work with and have a common sense discussion about why it makes sense to not only have these mask mandates in place, but also do whatever we can to protect our citizens. Because in Texas, this particular governor and its state legislature in Texas have fought so hard and heavy against us having local control. Many counties and many municipalities like ours in Missouri City have been stripped of power to be able to make our own independent decisions about what we believe is best for our citizenry in our counties, in our cities. And so, yes, privately they are sensible and common sense, many of them, but you have some fringe Republicans who wield a lot of power and hold a lot of key positions. And you got to keep in mind, these people are elected. They're elected by individuals. And so if you have some of your staunch supporters who are against mask mandates and are against closing us down or shutting us down to try to get past this surge, or to try to preach against vaccinations, et cetera, then you're going to see what we see, and people voting along party lines, which in many cases, sadly, is happening.
Yeah, and Jeff, we hear a lot about the attitudes of elected officials, including watching the impact of what appears to be bad decision making. What is your sense of the point of view of the average Texan when it comes to COVID?
Well, I mean, everyone here in Texas, if you look at polling, they know it's real, and they are supportive of any efforts that we have, majority-wise, to deal with this raging pandemic that has taken so many lives and impacted so many people. Then those that we had a city councilman in Dickinson, Texas, which is a municipality here, who went on social media and used his platform on the dais to rail against vaccinations and rail against COVID-19, calling it a hoax, et cetera. He contracted the virus, and several days after contracting that virus, he passed away, and they just held his funeral recently. And so they're now looking to fill his seat. And you have a lot of people like that, sadly, who have had it hit their front door, and now they're preaching a different sermon from their platforms, whatever they may be. And so the average citizen here, majority-wise in Texas, especially based off of polling, are very supportive of any effort that we could undertake to deal with, keeping our kids safe, keeping our citizens safe.
Yeah, and again, we're with Jeffrey Boney, the associate editor of the Houston Forward-Times and Missouri City Councilman. Jeff, first of all, James Wright of the Washington Informer writes in. He says, "I want to be the Jeff Boney of D.C." Claudette Perry, our executive administrator, says, "Good morning, Jeff." Bobby Henry says, "We have seen and are learning very fast that there is cash in chaos." Jeff, so we know about the state legislatures in Texas. We know that Governor Abbott has signed into law some oppressive voting laws. At the local level, how are you guys planning to attack that? Because that obviously it affects everyone, but it certainly affects you in Missouri City as well.
Yeah, so we're subjected to the laws of our state, and we have to adhere to those without question. And so, that's why I always preach elections matter. Who you elect in office, not just who you have as your president, but who you have as your governor, who you have as your United States representatives or United States senators, or your state representatives as well, whether they be senators or representatives. All of them matter. Your county governance matters. Your local elected officials matter, because these are the most people that are going to impact you the most. And sadly, there's, I hate, we have this moniker and this slogan in Texas, everything is bigger in Texas. I hate that across the country, it's almost like people are saying everything is crazy or everything is more chaotic in Texas.
Dr. Chambers, let's bring you into the conversation.
Well, I I think what is going on now is reached biblical proportions. I think the governor of Texas is a devil. I think the governor of Florida is a devil. I think the governor of Georgia is a devil. And people of righteousness, it's time to stand up to these devils.
Well, those are the words of the civil rights leader
Ooh,
and
wait.
the leader of the NMPA.
I think we should drop the mic and end the show right now.
Those were the closing thoughts, right? Right, Jeff?
Yeah, I don't think there's anything else that needs to be said.
Jeff, what impact, let's just go back briefly to your bout with COVID. What impact did your personal experience with the virus have on your family, your friends, your associates? Did it change the mind of anyone that had doubts or was skeptical about vaccinations?
Oh, absolutely. I mean, like I said, I was not only one of the first individuals in the greater Houston area to contract COVID. Me being a high-profile individual here, a public figure, community, leader and activist in the community. I was on the news practically every day. Primarily because I'm a council member, an elected official. So I was on every single news channel, and
you were. I saw you.
I mean, it was like, seriously, no joke. It was like they reported on me literally almost every day about what was going on with me. And I was like, I don't want to be a celebrity in this particular regard, but nonetheless, I wanted to take this serious and understand that people listen to my voice. And so I wanted to use it as a platform to educate, equip, and empower our community and the people in the greater Houston area about the seriousness of this pandemic and how it impacted me personally. Matter of fact, I started, joking around and believing initially, like, before it even got serious, that, Black people can't get COVID-19, because nobody Black had been reported to have gotten it. Then I remember the basketball player out of Utah contracted it, and then several other, like Idris Elba and others, started getting it. And I was like, oh man, this may be serious. And then I got it. And so, yeah, people around me did take it seriously. Many got tested. Many got, once the vaccination has come out, they got vaccinated. They started wearing masks. They started staying at home, social distancing. So a lot of them took heed to what was going on and began to see how serious it was, especially when they started seeing how it impacted many people in their particular life, family and or friends. People died, that they knew or that I knew.
Yeah, you mentioned at that time thinking Black people couldn't get it.
Yeah.
Well, I have not used this word. Well, let me say it this way. I've used this word more than I've ever thought I'd use it, disproportionately. Black people are disproportionately affected by COVID. The CDC has confirmed that. The World Health Organization, which is an international body, shows that Black people of African origin, is disproportionately in a large way affected. We had, again, Dr. Hildreth on the other day, and he talked about how Black and brown kids are dying left and right because of COVID. Jeff, again, so you're a council person, you're a journalist. You put on both of those hats. Which hat do you wear more, Jeff?
I wear the Jeffrey L. Boney hat. That's just being me. I'm not defined by what
Jeff
I do.
Jeff says, don't argue with him.
Yeah, I'm not defined by the job titles that I have or what I do professionally or publicly from a political standpoint. I'm Jeffrey L. Boney, and so that's the hat that I wear every day. And when it's time to put on those various other hats, I put them on. But I'm always going to be me.
Yeah, absolutely. And that's what we love about Jeffrey Boney. And you can watch Jeffrey. He has this show on Wednesday afternoons. It's 1:00 Eastern, I believe.
Yes.
1:00 Eastern, 12 Central Time. Y'all don't want to argue with Jeff. It's Real Talk. Real Talk Junkies with Jeffrey Boney. We always look forward to seeing that show. And you never know what you're going to hear and see on Real Talk Junkies. And
that is true.
Check it out, though. It's an awesome show. I catch it. It's on here on Facebook. It's on Twitter. I always catch it on Twitter. And I believe it's on YouTube as well. But you got to check out Real Talk Junkies with Jeffrey L. Boney of the Houston Four Times. One one of our best newspapers in the National Newspaper Publishers Association. Dr. Chavis, I know we're running out of time, but I kind of figured we would go over when we said Jeffrey was coming on the show, because there's so much to cover with Boney. And we haven't even scratched the surface this morning. Dr. Chavis, I'm going to throw it to you.
Well, thank you, Brother Boney. You are a blessed brother. And because you are blessed, you are extending your blessings not only to Black America, but to all of humanity. We salute you and we support you, and Godspeed to continue to give you good health, good vision, as well as out there on the front lines battling. I wasn't kidding, battling these devils, you know. And I think that's what we involved with. 194 years ago, Freedom's Journal had to call out the devils supporting slavery. And 194 years later, that's the calling of the Black press today in 2021.
Well, make plans now to join us for the NNPA's National Leadership Awards reception. Is coming right up September the 16th at www.virtuennpa2021.com. This year, we are presenting National Leadership Awards to Olympic champion Allison Felix, Senators Cory Booker and Raphael Warnock, Congresswoman Cori Bush, and Doctors Ebony Hilton and James Hildreth. So join us at www.virtuennpa2021.com. And if you sign up, we got some treats for you. You'll also be able to see special appearances by the great Regina Bell and actress and author Gabrielle Union. So among others too, because we got some more surprises in store. So if you register now, you get all this free. www.virtuennpa2021.com. And it's the weekend, so y'all check out the Chavis Chronicles Sunday on PBS TV and PBS World, starring our boss there, Dr. Benjamin F. Chavis Jr. It's a great show. It's an extension of what we do here at the Black Press. It represents the Black Press of America on PBS TV and PBS World. And don't forget to check out the NNPA and the Black Press of America on TikTok at NNPA Black Press. That's right, we TikToking, y'all. And let it be known, remember this: try to be a rainbow in someone's cloud. Everybody have a safe weekend. Get vaccinated if you can. Wear a mask, social distance, and be healthy. And join us on Monday. Have a great weekend.